Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Kwasigroh, and joining me today via phone call is Miss Deann Thelen. She is the CEO of Jackson-Madison County General Hospital. Deann, how are you?
I'm doing great. How are you?
I'm doing great. Thanks so much for joining me today. I really appreciate you taking the time from your day to just talk about Jackson General and us brag on it a little bit. So thank you.
Absolutely.
Yes, ma'am. So we'll just go ahead and dive in with getting to know you a little bit better. So how long have you been with West Tennessee Healthcare?
I came to West Tennessee Healthcare in the early spring of 2012, so it's been about going on 9.5 years. I came from the University of Iowa, where I spent a majority of my career prior to that.
That's awesome. And how long have you been CEO of Jackson General?
When I first arrived here, I started as a vice president of hospital services. So I had several clinical areas in my span of control. And then about 2.5 years ago, when we decided to reorganize as a health system, I took on the position as vice president and CEO of Jackson.
That's amazing. We are certainly glad to have you. You're doing an amazing job. And
thank you.
Yes, ma'am. So what services are offered at Jackson General? I know that might be kind of a hard question to answer because we have, what I understand, a ton. So
yeah, we do most everything. We have all the services, most comprehensive services. We are a quaternary referral center, so we serve all the higher end needs for over 600,000 people in all of West Tennessee healthcare communities. The only services that we don't, it'd probably be easier to tell you what we don't do, but what we don't provide is we do not have a burn center, certified burn program, and we do not do organ transplantation.
Okay.
Those are two of the big services that we refer out, and probably won't do those. Organ allocation is something that is very tight and needs to go to services who can provide the most value, and
Sure.
And those are offered in both Memphis and Nashville. So I think that's in the best good of all the communities. And burn center is another thing. It's highly specialized. Takes a lot of subspecialists to take care of severe burn victims. So those are two services that we probably won't be in the future either. But for the most part, we provide services for just about anything else here at Jackson.
All right. How many beds are offered at Jackson General?
So we have a total of 792 beds. That's a combination of both campuses. I think if people don't know that the North Hospital, formerly Regional Hospital, when we acquired that is a part of the Jackson General facility. So 642 actual licensed beds in this building and 150 licensed beds at the North Campus. So a total of 792.
That's quite a few. I was actually at North Campus not long ago, and I happened to be in the area where they were doing some construction. And so far it looks really great as you can look while construction is going on. But I do believe it's going to be a very nice space once it's all finished up. So I'm excited to offer that to our patients and community as well.
Yes, I am so excited about the North Campus. The construction's ongoing. When we visit it gets further and further along all the time, but excited to be able to open 8 brand new operating suites and a brand new pre- and post-operative care area, a brand new area in the front, the lobby. It's going to be really nice, all updated. I'll have a coffee bar and kind of a boutique type feel.
Oh, nice. That's
place
awesome.
Where people can charge their phones, work on their laptops while they're waiting, and it'll be primarily orthopedic surgery and outpatient services. And we actually have a lot going at North now. The ER is fully functioning. We have a lot of radiology services, including interventional radiology out there, and also our sleep clinic and sleep labs moved to the 4th floor of the North Campus. During the COVID pandemic when we first broke with COVID.
Mm-hmm.
So a lot of things going on there now, and it's getting pretty busy, but it'll be even busier when we can open the doors, hopefully by the first of the year for the orthopedic center.
That's coming up pretty quick. It seems like a little ways away, but it's very fast approaching. That's awesome. So how many patients does Jackson General see annually?
Oh, just a little bit under 30,000 discharges probably on an annual basis. I think last year we were right around 29,000. So several. Outpatient visits, usually that's our observation and people who come in for outpatient status. That's about 170,000 annually.
Okay.
So quite a few people come into our building annually, and we're happy to take care of them and do the best that we can.
What services are offered in the ED?
We have a fast track location. She's kind of an ear infection, the stuff that needs to be seen and maybe medications ordered for, but isn't going to be admitted to the hospital. So we try to run that through that area of the ER.
Okay.
Trauma rooms are bigger where the most critical patients come and are treated. We have areas for people with psychiatric needs that are specialized in our emergency room, and those are in a separate area, different rooms. We have room dedicated to eyes. We have all kinds of different rooms. They can be, commingled and used differently, but it is somewhat subspecialized as you go through the emergency department.
Okay. So why should people in the Jackson area choose Jackson General Hospital for their healthcare needs?
Well, I could probably come up with a lot of reasons. I think primarily is we're family. And I think whenever anybody needs health care, whether that's at the happiest times of their life, having a baby or a grandchild, whether it's at their most difficult times or when they're ill and not feeling well, I think everybody likes to be at least cared for by family, by someone who feels like their family. And I think that's one of the best things about this facility, about Jackson General, is it is one big family. If nothing else, we've learned a lot through the pandemic, and I think one thing we've learned first and foremost in front of me is, this staff pulled together better than I've never seen anything like it. I've been in healthcare over 30 years, and watching people come together and do whatever it took to take care of the patients that needed us was simply amazing. And it's hard to even explain. You almost had to see it to understand it. But
Sure.
The compassion and the care it's irreplaceable. And now that, COVID's come back and different variants and we're getting, another run at this, our staff are stepping up even stronger. They were exhausted, they were tired, they were ready for a break, and it's back, and they're jumping in and just like they never missed a beat. They're doing everything they can to, support and take care of the patients that depend on us. And the census is high and patients are sick, and they just take great care of people because they care. They do. They treat everybody like family. And of all the things, we have great doctors, we have great nurses, we give great quality outcomes. But I think the one thing that would strike me the most is just the compassion and the care that's provided by the staff.
Yeah, that's fantastic. I've interviewed several CEOs so far for this podcast series, and all of them have said very similar answers. So it's encouraging to hear so many people are coming together to take care of the community. So where in Jackson is this hospital located?
The actual address is 620 Skyline Drive. It's kind of in the center of Jackson. It's close to downtown. It's close to the north facility. Our north campus is right by Physicians Drive, right off the bypass. Mm-hmm. So that's, if you know where Outback Steakhouse is, it's directly across the bypass from Outback Steakhouse. So really easy to get to, both north and the main campus in Jackson. Easy to spot. And when you come around a corner on Skyline Drive, or you come around Highland and come up over that hill and get close to the medical center campus, it's hard to miss. It's a great big building and pretty impressive to see.
It almost was like a mini city. So the first time I drove by, I was like, oh, this is massive.
Yeah, I remember when I came for my interview, my first interview down here, and I'd come from, it's coming from the University of Iowa, which is a really big campus. Mm-hmm. And, I'd never even heard of Jackson, Tennessee. And I thought, I never want to work at a small hospital. I have to work at someplace big because that's all I know. And it's what I love. And I came up over that hill and saw this campus, and I was completely blown away at the size and the breadth of Jackson General, and just the entire campus with all the doctor's offices and facilities, the imaging center, the surgery center, Skyline Endoscopy,
Mm-hmm.
Everything's right here. Cancer center got built shortly after I came. So a lot of great care, a lot of great facilities right here in the center of town. Having the opportunity to be here in Jackson and I call myself a teammate of 4,000 people, and it really does feel like that. It takes everybody from the physicians who work in this building. They provide the best care. You can see it by some of the accolades with our heart program and with our cancer programs. And we just got 2 new neurosurgeons joining us. And the services provided and the care provided by our medical staff is amazing. Our frontline staff, the nurses, the respiratory therapists, the physical therapists. phlebotomy, all the staff that work to take care of patients every single day. They're fantastic. They love what they do. It shows. They're owners of this place. They're totally compassionate. They want to make sure that the families and the patients get the best care that they can possibly receive. They're advocates on a daily basis.
Mm-hmm.
If they see something that needs to be fixed or something that we can do better, they point it out. We talk about it. They go above and beyond every single day. They work tirelessly to give of themselves for others. You think about services that aren't always known as being clinical, the food and nutrition teams, our environmental services teams, our billing and compliance teams. Everybody is a part of taking care of every single patient. From start to finish, it takes us all. And it really is just like a big team. You need every player on the field to make it happen. And
Sure.
if one of those players isn't there, you can't win. It's not going to happen. So having everybody there, everybody working towards the same goal, everybody sharing their same purpose and their same why. These guys are great. These guys are fantastic. I couldn't be more proud to be a part of it. And I'm happy I came here 9.5 years ago. I'm happier now. Even going through what we went through, we went into it together. We came out of it stronger, and I'm just proud to be a small part of it.
That's exactly what I was going to say. I've been here for 6.5 years, and it's been just the best team to be a part of. And I'm very lucky to have you as our CEO and lucky to know you as a person. So from the bottom of my heart, thank you for what you're doing, encouraging everyone. I get your weekly letters from the CEO, and I read through those, and it really is encouraging. So thank you for what you're doing to help make this community better.
Absolutely, and thank you too.
Absolutely. So thanks for coming in today. And listeners, thank you so much for listening to another episode of We Talk Health.